Well, I chose to be a gynecologist and obstetrician as a specialty simply because I think it's a very happy event when you deal with women's conditions of this nature. Of course, in the delivery of a baby, it's really a wonderful thing to see life come to being. And it's a very happy event, and I enjoy that. Even in gynecological surgery, when a woman has a disease like a fibroid or endometriosis, cystic lesions of the ovaries, once it's removed, the fruits of that, the outcome is really something very rewarding to me. If a woman finds it difficult to conceive, it is possibly because of the fact that the expectations are high. One must understand, first of all, that it takes almost a year or even 2 years for most healthy young couples to conceive. In fact, 90% will take up to a year before they really conceive. So don't be stressed about it. Don't immediately go for intention of going for in vitro fertilization or see a doctor to do something about the condition. If you're healthy, your menstrual cycles are regular, and you're not grossly overweight, and of course your husband has got no surgical history or any medical problems, you will conceive with time. And give it a good 6 months period, a year, even before you seek medical help or medical advice rather than help, because you may not actually be unable to conceive. So stress is a very important component of the ability to conceive or not. 3 most important things for the protection of reproductive health. I suppose it's a matter of when you're trying to protect that. Generally, a person should be leading a healthy lifestyle from the word go, practically from after birth, and you can manage it yourself. And of course, health comes with, second thing is regular exercise. Because if the circulation in the body is good, then of course the person's ability to do anything in terms of having a child when they want one becomes easier, becomes a natural thing rather than, it's not a difficult thing to get pregnant if one is really healthy. And the third thing, of course, I would say is protect yourself as a woman, protect yourself against any infections. Right from the first sexual encounter you have, you can pick up a lot of diseases which can sometimes, and in fact quite often, damage your ability to have a child. So be careful of that. Choose your partner or partners wisely, and use protectives from the word go. Yeah, if you do have PCOS, or what is known as polycystic ovarian syndrome, and that occurs quite commonly. I can't really tell the extent of its occurrence simply because there's a whole range of it, mild to moderate to severe, and it varies from time to time in your life. So if you do have this condition, severe enough, it also always demonstrates itself as infertility or hair growth. A lot of young women have got excessive hair growth. You have to go for to shave it or to wax it. Or even having a deeper voice, or even a mustache growing. So if you do have condition of PCOS, then what you should do is actually seek a doctor's advice as to using certain medications. We now have a very simple medicine which is actually something which we use for diabetic people, which works very well for PCOS patients. And I've had young girls who are excessively overweight, without regular menstruation, sort of slim down to a nice figure with regular menstruation after some time of using this medication. Of course, in terms of lifestyle, keep yourself healthy. Be very mindful of having regular exercise, and be mindful, of course, of not excessive weight gain from too much eating. Oh, liposuction is a hobby of mine, so it's a good question to say, what is it that people have myths and mysteries about the procedure? I think generally one should understand that liposuction is not a means of weight reduction. It is a means of shaping the body, of sculpturing the body. So if you understand that is the need, then what's the most important prerequisite before even considering liposuction is to make sure you maintain a fairly good and healthy weight range. And then the liposuction is indicated, and it is by and large, despite some of the recent bad news, by and large liposuction is very, very safe. If it is done under proper conditions and by a surgeon who is actually very competent in it, it shouldn't be an issue in terms of safety. Well, I have a lot of interaction with my patients, and I love that interaction that goes on most of the visits and even during any surgical or obstetrical procedure. But generally, I would love that the patients look at me as somebody who's competent, somebody who's concerned, and of course who's caring. I think that's the role of a doctor basically anyway. So it's something which I like to have my projected impression onto the patient.